over the last 15 years is where we've really seen the change, not so much in the parts that we put in a knee. Where we've seen the change is in what we call the perioperative management, okay? And so that encompasses everything from anesthesia to nursing to the physical therapy, as well as our surgical techniques. A little bit smaller incisions, try to be a little bit gentler with the tissue. The single biggest thing though is the types of medications that we use. We use what we call multimodal analgesia, which instead of in the old days, fill them full of morphine and hope that that manages their pain, now that we know that there are several different routes how pain affects you, and so we attack each of those different routes with different medications. And with that, what we've seen, I've been in this business a long time. When I first started, our patients were in the hospital 7 to 10 days. Now we're looking at outpatient surgery for knee replacement. That's just a phenomenal change. The advances in knee replacement surgery, if I had to pick the single biggest advance, it would be in the perioperative management, which includes multimodal analgesia. So we give several different medications for pain rather than relying on some of the old standbys. We rely on getting patients up and moving because we know that motion is lotion, and the quicker we can get them moving, the better off that they do. And with that, what we have seen is a dramatic decrease in our lengths of stays.